Welcome back to Survive Outdoors. Dan Williams here. At Survive Outdoors, we address wilderness medicine, injuries in the outdoors, and how the practical layperson can take care of those injuries, try to inform you about certain infectious diseases that are out there in the outdoors. Today is our third installment of Lyme disease. Today we're going to talk about what is the treatment of Lyme disease. Let's start out with the bite. So a Ioxides scapularis, the deer tick, black-legged deer tick, there's two species, one in the Midwest, black-legged deer tick, and then on the West Coast there is the Pacific Western black-legged tick. And that is the tick that carries Lyme. So it has to bite you, number one, and it has to stay on your body for a minimum of 36 hours. And that varies a little bit. Obviously, it's not exactly 36. And I like to just say it has to be on your body for 24 hours or more. And during that time, that is when you could contract the Lyme. But let's look at this realistically. It has to be a deer tick. That deer tick has to be carrying Lyme disease. It has to bite you, and it has to be attached to your body greater than 36 hours, or greater than 24, less than 36. Now, once that you do that, and you remove the tick with tweezers or your fingers, either way, and you pull it straight up at 90 degrees, and you should, that is the best way to remove it. No cotton swabs soaked in oil, no lighter, unless you want to come to the clinic with a first-degree burn. None of that. You're just going to take the tick, you're going to raise it up. You don't have to worry about squeezing it. You're not going to get Lyme disease if it touches your hand. Just pull it straight up at 90 degrees, done. The bite will itch. You'll have a little bit of a red mark. You can treat that with a topical steroid cream, and that helps the itching a lot, or Benadryl. So if you are in an area, you come in to see me, for example, at the clinic, and you're in an endemic area, we know for a fact it's a deer tick. You're in within the first 3, 4, 5 days. You can be treated with 2 tablets of doxycycline, done, and very effective. The next stage is early disseminated stage, stage 1, and in that stage you could get the Lyme rash. You could see that, and if you looked at our other video, we talked a great deal about erythema migrans, that target rash. In this stage, you can get swollen lymph nodes, may or may not have a fever, some joint pain, excuse me, and in that phase, you're looking at doxycycline, 14 days, 1 twice a day, amoxicillin, 500 milligrams, 3 times a day for 2 weeks, or Ceftin, which is cefuroxamine, and that's 500 milligrams twice a day for 2 weeks. Have done tons of studies, and one of the studies which was very interesting in early disseminated Lyme disease, they did a study that showed head-to-head oral doxycycline against IV antibiotics, and there really was no major difference. In fact, the oral tablets did very well. That is not the case in third stage disseminated Lyme disease. So I need to briefly talk about Doxy. It is a fantastic medication, works great, but we don't give it in children. And a word of caution when you take Doxy is that you can be very photosensitive to the sun. You can get burned very easily while you take doxycycline. No milk products when you're taking Doxy. No calcium tablets, no Tums. That will decrease the absorption of it. In very rare instances, you can get some esophageal ulcers, and I have not had any of those issues in terms of the esophageal issues in greater than 30 years of prescribing it. And I've had very good outcomes. So stage 3 is the late stage. This is the more serious stage, and the only way you get to stage 3 is if it goes misdiagnosed, or it was treated inappropriately early on, or it was just missed. And in that stage, IV antibiotics are really the mainstay, and they can usually put a port in, and you go back for a month to 2 months, or you're in the hospital for a short period of time, and then you'll be coming back to get those IV antibiotics. I'm going to kill me about 20 flying midges here in a minute. I want to talk briefly about labs, and it gets a little bit complicated, but I'm going to make this as base as possible. You get bit by a tick, the Ioxides scapularis. Your body then starts to make antibodies. The first antibody your body makes is IgM. That antibody, it takes about 3 weeks for that to become positive if I did a blood test on you. So if you come in 2 days and you want a lab test, a Lyme disease lab test, it's not going to show anything. It's just like a young kid with the sore throat and fatigue, and he may have mono. Drawing antibodies or doing a mono test that quick, it is going to be negative. So you have to wait a period of time for the body to produce the IgM antibodies, and after about 3 weeks, then we would see if you had IgM antibodies. The next antibody to come to be seen is the IgG antibody, and that's the one for long-term illness. So what will happen is you'll come in, you want to get a Lyme test, so we draw the antibodies first. So the powers that be have this system. We do the IgM IgG antibodies. One of those have to come back positive before the lab goes into the second phase of testing, which is, for example, a Western Blot. Now, a Western Blot has many bands on it. A band is a specific area of the blood test. And this is important to talk about, even though I understand it's dry as can be. But in the United States, the CDC recommends you have to have 5 out of 10 bands on the IgG, you have to have 5 of the 10 positive in order to be diagnosed with Lyme. And on the IgM, you only need 1 of 3 bands. Now, why is that a problem in my eyes? It's a problem in my eyes because so many clinicians out there are treating the lab test and not the patient. And I tell a lot of students, I tell a lot of young graduates, I say, look, you treat the patient, you don't treat the lab test. The lab test is only a tool. There's many tools. There's the exam, there's the history, which is extremely important. Where were you in the last month? Have you gone hunting, hiking, fishing, camping? Where do you live? Blah, 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 blah. So all of these are just tools. The most important is the patient, and we get away from that. If you go in the emergency room, first thing they're going to do is about 13 tests, and yes, they're in a hurry, yes, they're jammed, yes, they're overwhelmed, but again, you have to treat the patient. And I'm going to show you a lab test of a patient that has 4 positive bands, and according to the lab criteria, she would be negative. But this person lives very close to the woods, works in the woods all the time, headache, joint pain, fatigue, muscle aches, everything else was negative. CBC negative, for white count, rheumatoid negative, profile was negative. So I actually called the lab because they weren't going to do the second phase test, which is the Western Blot. And I said, could you please just do the Western Blot? And the lab said, well, she doesn't have a positive IgM or IgG. I know, just humor me. Just do the Western Blot if you would, please. And I said, sure, we'll do it. And it came back with 4 of the 10 positive bands. Well, that's pretty significant. It did not meet that strict criteria, but 4 of the 10 bands on the IgG was positive. So I ended up treating this person for 2 weeks of doxy, and they got better. With, according to the strict guidelines, a negative lab work. So that's important to at least put in the back of your mind. When you go to a clinician, and a lot of the clinicians and docs are awesome, they're fantastic, but tell them you want a copy of your lab results, even if it's negative or positive. Create your own file at home and keep that information in there. At some point you need a second opinion, do some research on your own. This is not distrusting the clinician. What this is taking care of you and keeping a history of your medical record. So keep that lab work and look at it. The other thing that I wanted to mention briefly is steroids. In this situation with Lyme disease, actually steroids have shown to have a worse outcome. Wanted to just toss that in there in case anybody's afraid they might have Lyme disease and they get steroids. You might not want to do that. So If you have any questions about any of this, and a lot of this today was a little bit above the layperson, it was more medical, I understand that. If you have any questions at all, please write them below. I'll do the best to answer them, and if I can't answer them, I'm going to find you the information. In the meantime, if you like this, you got some good information, give me a thumbs up. Please subscribe, very important. Keep your eyes on the horizon, your face to the wind. Till next time, guys, take care.